obviously, I have seen way too many people die, and it has been horrible to watch. I do believe that if the first wave had been the Omicron wave, it would have crushed our medical systems. I don't think there's any way the hospitals would have survived that. But because we'd had practice, we were kind of ready for the Super Bowl, and we were able to get through that with a little bit more ease than maybe it should have been. I think we would have been New York City just as much as anybody else. The very first wave had Omicron been the first wave. So all of those things, yes, I don't like a lot of the stuff that's been bantered back and forth. It's all kind of disgusting. I take sanctuary in the science. That's where I love to be, is reading the papers and understanding the science. And there is nothing more rewarding than seeing people make it. We've had in Oklahoma at two of the major systems the very welcome addition of Department of Defense medical workers to give us a little bit of respite. But the health workers are still tired. We're all still tired, and we're continuing to age quickly as this continues on. It's still challenging. We've had a number of people pass even with Omicron, even though it's touted as being less severe. The fact of the matter is, an ICU patient with Delta, Omicron, Alpha, Beta, Stealth Omicron, or anything like that is still an ICU patient with coronavirus. And so we've had a number of those. And this week now, we're starting to see a lot of those people who have been on a ventilator for 3 or 4 or 5 weeks now, coming from the surge, starting to succumb to their illnesses. So it's been a challenging week for the front lines in that regard, people who you've developed a relationship with. The silver lining, of course, has been we've been able to, at INTEGRIS at any rate, we've been able to allow visitors in some of the COVID rooms, and so that people are able to have the comfort of family. That makes it a little tougher on staff sometimes also, though, when you see the family members there. So bottom line is we have a tremendous healthcare workforce in Oklahoma, and please continue to show them your appreciation. You don't have to beat on the pots and pans anymore. We're not expecting a flyover, but we still like a pat on the back every now and again.